risk factors of eclampsia are priming gravida, elderly priming, pregnancy interval if it is more than 10 years, family history of preeclampsia or eclampsia, or a previous history of preeclampsia, or if it is a multifetal pregnancy. Now, eclampsia comprises of signs and symptoms of organ failure like seizures, severe headache, visual disturbance, altered sensorium, and coma. Now, along with this, the symptoms of preeclampsia are present, like it is hypertension. Normally, the definition of preeclampsia is hypertension that is more than 140 by 90 mmHg, along with signs of organ damage, organ failure, like altered liver function test, elevated ALT, or elevated creatinine, urine creatinine ratio, urine albumin creatinine ratio. So this is the definition of preeclampsia. Along with this, the symptoms of preeclampsia like thrombocytopenia, proteinuria, and ultimately it can lead to HELLP syndrome, which is very rare and occurs in 0.1% of deliveries and can lead even to death. Now coming to the case, to summarize, Mr. X, 39 years, priming gravida, admitted to our hospital with BP on admission was 170 by 100 and altered sensorium where GCS was almost 5 to 6. So on examination there were bilateral crepitations in chest and urine dipstick showed protein 2+. Per abdomen examination showed fetal heart rate to be around normal, 140 beats per minute. Sorry for the interruption. Now the patient per abdomen was fetal heart rate was normal, 140 beats per minute, and fundal height was according to the LMP 30 weeks fundal height. PV examination showed the mother was not in labor. Now after that the mother had 4 episodes of convulsions in our hospital in the triage room itself, with history of 2 episodes outside in the car. Immediately she was resuscitated with moist oxygen at the rate of 12 liters per minute by face mask, IV fluid RL, continuous Foley's catheterization, and her started on and her urine was tested for dipstick which showed 2+. For medication, she was immediately given injection Maxalf loading dose as per the preacher regimen, followed by antihypertensive labetalol. Then she was prepared for emergency LSCS under general anesthesia in OT after primary stabilization of the patient. And the procedure was uneventful, boy baby of 1450 grams delivered. Now after LSCS, she obviously could not be extubated. So according to the anesthetist consultant, we sent her along with the ET tube to the HDU. Along with bag and mask ventilation and put on ventilator in HDU. Now after LSCS, she received a stat dose of injection Lasix 10 mg followed by 10 mg after 12 hours, along with other like antihypertensives, antibiotic and analgesic, and injection levetiracetam. So injection Maxalf was withheld for 12 hours under the advice of our sir due to its side effect on CNS and respiratory depression. So it was withheld for 12 hours.